Hi, this is Robert Whidden, editor of Employee Benefit Advisor. Today we're with Tracy Watts, a senior consultant for Mercer, and we're talking about the National Healthcare Survey, which they just did a seminar on in Washington, D.C. for Washington, D.C. area employers. Tracy, thanks a lot for spending some time with us today.
Sure.
You're going to highlight some of the things that you found in the research and that also clicked with people you talked with yesterday. One of the first things I think you're going to talk about is year-over-year medical costs that employers or overall healthcare costs that employers are experiencing. Tell us what you found.
Yeah, for the fourth year in a row, we found that employers have managed their healthcare costs to right around 6%. When we asked them what they are projecting for 2009, they're sticking with that 6% number. So that's looking like a budget number on average for most employers in terms of trying to manage their healthcare costs to that level.
And one thing, you have a question mark on the slide talking about projected for 2009, 6.4%. There's a lot of uncertainty out there, though, in the marketplace about what's going to happen with the economy. We should talk real quickly. This survey was completed, or the data was gathered mid-year 2008.
Right.
So how is that affecting?
We fielded the survey in the summertime. Results were collected early fall. The timing of the reporting on this data was really before a lot of the news started hitting us in around October about the economy. So since we fielded the survey, the million-dollar question tends to be what's going to happen to trend. And it has a lot to do with individual employers, their business situation, and their business outlook. And so you're going to get mixed answers depending on that, because for an environment where the outlook is strong, you may have people kind of putting off care because it's a high out-of-pocket, not because they think that anything bad is going to happen, because they just have other financial priorities, where you'll have some businesses that the outlook is not so good, and so people are going to be rushing to get care and to take care of things. And so, depending on your situation, that's going to have an impact, either positive or negative, on your trend. And then when you add in what's going on with the providers, we do think that there will be pressure from the providers to increase their costs because of what's going on in the economy and because of their traffic through their offices and through hospitals declining.
And the last question I have about this slide, and I'd like to leverage your experience, you've got more than 20 years in the industry. I look at it and you see some spikes over the past, 20 years that's being cataloged here. You got the impact of managed care, learning the managed care system. Healthcare reform's a big issue now. There's a lot of people who are sort of coming to the healthcare discussion and I think are going to look at data sets like this and come up with some kind of decision or thought. What is your thought when you look at this? Is this just we've tried different things in the industry and had a variety of luck with managing costs, or do you take something else away from the fluctuation in trend?
Yeah, you're right. We have tried a number of different things. Way back at the beginning of this chart, we had the introduction of PPOs and then the rising popularity of HMOs, which actually got us to our all-time lowest trends. And then as those strategies ran their course, we kind of spiked back up to where we ended up in 2002. I think that the flat trend that we've seen over the past 5, 6, 7 years is really attributable to us finally getting managed care and consumerism right. People are comfortable with they have to take ownership for their care. The tools every year get a little better and a little better. So I do think we're doing some things right. We are, and others are, projecting that there will continue to be a rise in popularity of consumer-directed healthcare plans. And there is some merit to the account-based approach, but there's also a ton of merit to all the programs that go into supporting that kind of a plan design that help you with disease management if you have a chronic condition, or other types of tools just to help you be a better consumer.
Okay, well, great. Thanks for walking us through this slide here, Tracy.